Well, today I'm going to talk about the nursing metaparadigm, in which there is four concepts: the environment, health, person, and nursing. We're going to take an actual journey. So I'm back. So we're getting ready to start our journey, and I'm going to talk about the first concept, which is persons. Okay, so let's talk about the person real quick. So a person is a being within the world. Could be a patient, a family member, or someone in the community. I'm in San Marcos, so got to be somebody here in the community, or just someone in society itself. It's like a holistic being. So I'm a person, you're a person. Yeah, and let's see some. So I can quickly talk about, while I'm waiting on the doctor, the concept environment. So environment, this is an external element which affects a person internally and externally, or both. There's stressors from extrapersonal, interpersonal, and intrapersonal, which plays a huge role. Stressors from home, stressors from work, stressors coming in here. Anywhere where there's nursing care, there can be a stressor. So we have to remember the environment that we place our patients in need to be more of a caring environment. So as you see previously, even though this is only a doctor's visit, am I stressed a little bit? I think so. Let's again see what happens after the doctor sees me. Thank you for following me on this journey. I still have 2 more to go. Well, I just finished my office visit. It actually turned out well. The initial nurse that I seen, she didn't show much of a caring attitude, but when the RN came in with the doctor, I seen it through their emotions, them listening to me, of my concerns, addressing, how I feel, where I want to go with whatever I'm there for, you know, it was just amazing. That's all I can say. Yeah, the environment, at first is kind of cold, being a little bit in those yellow walls and, that bed, like, okay, what are they going to do for me? But once I got the feedback from them, which was a caring, it helped me ease stressors away. It helped me look at things more positive. So overall, the 4 concepts, they kind of interchange. They need to influence each other to happen. With that, let's go ahead and move on to the next concept, which is health. Okay, so the next concept is health. What it is to me is basically having the ability to function independently, adapting to the stressors, achieving life to its fullest, basically quality of life. And as I sit here in this parking lot and I look around and I see, people coming in and out for care, everybody wants to have this optimal quality of life. In nursing, initially, when I first got into it, I, kind of viewed health as simply just being healthy and having no comorbidities. But you see today, many people who have comorbidities are adapting to life. They're living their life to the fullest. They have sustained some type of quality of life. And with that, because with that nursing, if we add that care element to them, then they can. I can say, I can give you a story. Okay, my grandmother, who had a stroke 8 years ago, she adapted to her stressors, which basically one of her stressors is that she has left-sided weakness. With her, she's still feisty. She's still chasing the boys. She still will say that she is the queen of the family because she's adapted to her. Having left-sided weakness is fine with her. It's her quality of life. Yeah, she is 85 years old. Seems like she's going on 21 because she wants to chase all the guys and all that, but she's happy where she's at. She couldn't want more from anything at this time. So, you know, when I think of health, just because my perception at the time of health, you know, if you have diabetes or, you know, cardiovascular disease, saying that you're not healthy, maybe my perception, but it's more of what the patient's perception is, and it's just basically supporting them on that. And then too, looking, and when you caring for them and loving them, you know, then maybe they can see a different view, how you see it, and then you see their view. It kind of works both ways. So in a way, I see health as more what the patient sees it too, as well as the nurse. Moving on, my last concept is nursing. So come back shortly and we'll talk about nursing. So I'm back to talk to you about the last concept, nursing. It's all the things that we do. It's the care itself. When I actually think of nursing, I think of actually caring for people. But I'm learning that it's more than just caring. I can recall many occasions in which I've cared for a patient, and just the way that I've cared for the patient helped them. Let me give you an example. I can say there's one time I was working in the OR and a patient came in there and she was just extremely nervous. She was scared that she was going to wake up. You know, she was told, you know, all these myths about this and that and that. And I believe the way that I approached her and me just grabbing her hand and listening to her and not being so rush made her comfortable. I told her just my story, and I told her exactly, I understand, you know, what she's going through. And then of course just mentioned to her, you know, it's normal to be nervous. Who wouldn't be nervous? And the biggest thing, I think, just taking my time with her and that touch, and just showing her that I've been in that situation and actually taken myself out of nursing at that time and putting myself in her place helped her. I remember her telling me she is so glad that I am her nurse in the OR, and she's still a little bit nervous, but she's to a point that it's okay. It's okay. And she asks me as we go in to the OR just to continue to hold her hand, and when she wakes up, hold her hand. At that time, I was only doing the OR and I wasn't doing PACU. So when I did take the patient out, I kept my promise and I stood by the PACU nurse and I said, you know what, I promised her that when she wakes up that I would be there. And I did that, and I received a card like maybe 3 weeks later with my name on there saying, simply thank you. You made everything, made me feel good. And that made my heart feel like, you know, that little extra step that I did, which to me was actually part of me, because I looked at her as like if it was my mom, my best friend, just somebody I really care for. So these experiences that I've had, and I've had so many now, I just have to remember that it's not just 1 or 2 or 3 here and there. I need to incorporate them all the time. And as a nurse practitioner, when I'm there for the patient, if, you know, listening to their questions, their concerns, giving, you know, give more of me, giving more care in every way that I can. So nursing is my last concept, and actually this assignment was kind of interesting. I was a little bit nervous, I'm not going to say. I did learn a lot. I learned a lot about myself, so I hope you enjoyed, and thank you.